Well, the troubling number to follow is the rolling 7-day average of new cases. Mississippi averaged just over 600 cases a day this past week. Hospitalizations are also way up. There are 602 confirmed COVID-19 patients in hospitals across the state right now, and there are another 261 patients with a suspected case. There are 161 people in the ICU and 94 on ventilators. State Health Officer Dr. Thomas Dobbs tweeted this graph this morning along with a message asking people to be safe this 4th of July weekend. He recommends celebrating only with people in your own household. A big part in fighting the spread of the COVID-19 has been contact tracing, but one medical expert says the data could be presented in a better way. 12 News' Alex Love spoke with him in the Department of Health about the coronavirus statistics. Alex?
Well, Byron, each of them acknowledge the threat to COVID-19 is growing fast in Mississippi and people need to step up. But it might be easier to notice that threat if cases, deaths, and hospitalizations were laid out more specifically than overall total numbers. As a senior medical coder for hospital systems from Louisiana to Arkansas, Eric Dolbear sees the key to displaying daily COVID-19 trends is better at a county level.
What I really am missing seeing is the overall trend and where the infection is blooming. And all I see right now is just a total number of infections and deaths per county. That doesn't tell me which ones are increasing and which ones are improving.
Showing some examples, Dolbear used Department of Health reports to measure new cases in his area. Over 2 days, Leake County had 1 new case reported, but then 17 the following day.
I just want to see a trend, just a spreadsheet with the daily count since this started, so that I can look myself by county and see are they having more cases or are they having less cases.
Putting those daily stats into a line graph, it showed the rate for Leake County growing at a much faster pace than anywhere else in the region. He linked the trend to people not seeing how their specific communities are at risk and ignoring guidelines.
Most of them are probably going to be talking with their neighbors or the families. If those people are not getting infected, they're not going to really be aware that it may be, a real bloom in their own community.
We are going to have some county snapshots that'll be available soon, and that'll provide some additional granularity for how those case counts are unfolding within their counties.
On the Department of Health's website, you can see graphs illustrating total hospitalizations and cases broken down to overall county stats, but it all begins through individual investigations.
If you look at our data that's on our website, we present those cases on what's called an epicurve. That's done on an individual case basis. That doesn't necessarily mean it occurred that day. There's often can be a delay of when that person really became sick and was reported to us.
Both the Department of Health and Dolbear pointed to state leaders needing to do more, setting an example when out in public, like wearing masks and staying 6 feet apart as much as possible.